Hello, everybody. This is NGO Soul+Strategy, and I am Tosca. One of the things that I always keep an eye out for is nonprofits and NGOs that are truly outcome and performance oriented. Because having a passion for a certain cause and a willingness to work sometimes long hours if needed for that cause for not as much money as one could potentially earn in the private sector, for instance, is not enough, in my opinion. Are we actually contributing to outcomes as a sector and as individual organizations? And how do we know that we are contributing? That matters. Recently, I came across an interesting, relatively young, new NGO called the Taimaka Project. In this episode, we tell the story of why Taimaka came to exist, and we will be exploring the themes of how to evolve from what I would call a startup organization to a ramp-up phase, and what it means to be outcome-focused from an organizational systems and policies and processes perspective, as well as from an organizational culture perspective. So with that intro, welcome Dr. Umar Abubakar and Justin Graham. Over to the two of you.
Thank you so much for having us, Tosca. That's a number of very kind things you just said about that. So hopefully we can be useful and productive on this call.
I certainly hope so. And Umar, anything you'd like to say at the beginning?
Yeah, thanks so much, Tosca, for having us. Really looking forward to it.
I am too. I enjoyed our pre-discussion when I noticed, Umar, how you also sprinkled in some humor and some teasing, and I loved that feature. So I'm looking forward to that. I think all of us, including myself, we should never take ourselves too seriously. So listeners, let me introduce you first to Dr. Umar Abubakar, and he is the co-founder and director, obviously, of the Taimaka Project. And that is an NGO working in Gombe state in Nigeria, and we'll hear more about it in a moment. Umar is a medical doctor. He used to work at the Ministry of Health in Nigeria, and he has degrees in clinical medicine, which is my shorthand, Umar, for what you have degrees in, as well as in public health. And I'm sure that combination is relevant in the case of the NGO. He manages Taimaka's team of nutrition care specialists, which we'll hear more about in a moment. He oversees the hospital's partners, and he ensures that the patients receive the best possible standards of care, which is very much what Taimaka is all about. And Justin Graham, our second guest today, is also a co-founder and director of Taimaka. He worked before that for the Special Inspector General for the Afghanistan Reconstruction phase or project. And he oversees technology, finance, innovation. I think also pretty important in the case of this NGO. And he handles Taimaka's tech portfolio, which you're going to have to tell me, Justin, what that is exactly, and manages their in-house digital case management database. So with that introduction, let me turn to you, Umar, first. Tell us about the origin of Taimaka Project as an NGO. Why did your organization come to exist?
It all started with one of our co-founders who at the moment, sits on our board in Path Aya. Path wanted to really do something that is quite impactful. Did some preliminary needs assessment, at that time. And then one of the things, that came up on top was post-harvest loans and also, irrigation, program for farmers. But we decided to go with post-harvest loans, thinking that it was the most cost-effective and the most, impactful, at that time. Path, and Justin, two Americans, on board. And then, at that time, myself, and Mohammed, four co-founders, quite bogus, which we trimmed, which down the line trimmed to just me and Justin now, Path sitting on the board of directors, and Mohammed, taking a study leave, I would say, doing his PhD, PhD in the UAE. Yeah, so we ventured into the agro, finance at that time, helped about 2,000 smallholder farmers, I will say. And going down the line, we decided to kind of do like a more vigorous, analysis of how impactful we really are. So we decided to collaborate with UC Berkeley at that time. Professor Ethan, led the team, and the results turned out not to be as encouraging as we previously thought. It was like 2x, maybe to 4x, with like add-ons, as in the best case scenario. So we decided to look at other avenues where our money, where our dollars will go as far, as possible. So did a lot of, needs assessments as well, look at other options, where there's, there are need, for us to come and really make, high impact, in the space. And then community management of acute malnutrition topped, that chart, at that moment. And I would be proud to tell you that at the moment, with GiveWell's, recent the data that community management of acute malnutrition, it's somewhere in the mid-20s, 20x, over 20x in terms of how, cost effective, this is. And then this is where we are putting thousands.
Yeah, just to say, I'd love to later on when we get to the outcomes part, without going into too much detail and technical, but talk about that, what you just said, that 20x factor and how you got there from an organizational perspective. Sorry, I was interrupting you. Please go ahead.
No worries. Where was I?
I think you're about wrapping up. You've treated thousands of patients. I think that's about where you were.
So in total this year, I think cumulatively we're able to treat about over 4,000 children with acute malnutrition, saving hundreds of lives, in that course.
So you transitioned into a focus on child malnutrition, and maybe just turning to you for a moment, as why did you, as 4 co-founders, choose this particular state within Nigeria? Why Gombe?
So we were very fortunate in that 2 of our co-founders, Umar and Mohammed, were from Gombe. So this provides kind of a high degree of access to government officials, local context, local talent networks, kind of all things that are very useful to a new organization that's starting out with very few resources. And then we're also fortunate that, like, when you look at kind of the macro indicators for Gombe, it's a place that is very high need. So kind of
I assumed that was the case. And Umar, how did you and Justin, for instance, meet? By which I mean, what made the 2 of you plus Mohammed, and I think there was one more co-founder, tell me if I'm wrong, but
right.
Why did you come together to do this? Umar?
Yeah, I think initially this sort of just happened, by itself. But I think going down the line, I think we, begin to learn, on the job, I will say, and we begin to identify, our strengths, and what we could do. And I think down the line, people's desire in like it isn't either sticking to what we are doing or even considering other options, in terms of like, their, life plans, I think turned out to be quite, I think, what we have at the moment, with Justin and myself just taking, around. Justin, nice guy, new haircut today.
It's good. It's good you can see
kind
with
of
the old haircut.
Kind of take like the more, external, matters, into his own hands. So external communications, fundraising, networking, and then, myself, being here on the ground, a trained physician, kind of could, put my feet on the ground and making sure that, the clinical components, of what we do are really, at least at par with the very best in the world.
With the very best in the world, and we'll get back to that in a moment too. Yes, and Umar, still one more question for you. What does Taimaka mean? Sort of for our listeners, what does it mean? The word?
So I think in terms of the word, it means something, but maybe likely close to nothing, I will say, in terms of, in the sense that one of co-founders path was trying to translate the word help in Hausa to
Help
make
in
it like
Hausa?
in help. Yeah, help in Hausa. But he kind of missed it and instead of going with like Taimako, he came up with Taimaka, which is kind of like a verb sort of thing. I mean,
We try
by
we try
mere
not to
saying
tell
it, you
this
don't get
story publicly. So when we first started out,
it.
Parth, in his infinite wisdom, decided to plug into Google Translate what is help in Hausa and came up with Taimaka and named us that. Instead of asking, our two co-founders who are native Hausa speakers, the correct version is Taimako, which is like to help. Taimaka is like a request for help.
Okay.
Um, and Parth and I, being about 2 weeks into this and having just made the website, we're like, no, we're not changing it. We can't change it. We've already made the website. We've already got the domain name. It's too late now. And now
Yeah.
we're here about like 4 years later. It was clearly not too late at the time. It probably should have been changed. But these days, when we tell the story, we say, it's about a request for help from others, from donors, from partners. So we
Got it. Got it. Again, I love how the two of you also know how to laugh about yourselves and about these kind of, arbitrary things that happen. I selected your organization because I had a sense from what your colleague Olivia had told me on a different occasion, and from looking at the website, that there are some things that might stand out about the Taimaka Project. So if you look not just at your programmatic approach to child malnutrition, but also how you operate as an organization. And you're a very young organization, right? You're only a few years old. So I'm going to call that shorthand a startup phase. But what is unique, you think, about both your programmatic approach, and I don't mean unique in a black and white sense, but what stands out somewhat from maybe a lot of approaches that NGOs use towards malnutrition, child malnutrition particularly, and what you think makes your organization stand out, things that you emphasize that you might not see so much amongst your peers. Maybe Justin, first to you.
Yeah. So I'll maybe start with the second part of that, because I think it kind of flows into what that looks like programmatically. So culturally, and in terms of like the way we think about things, I think Umar kind of hit upon this as like kind of the biggest thing when he was talking in terms of like X cash, and that's kind of a shorthand that we use
Yeah,
for
explain it.
comparing.
Yeah.
So it's a shorthand that we use kind of modeled after GiveWell, which is a large charity evaluator that your listeners may be familiar with, that's used to compare between outcomes in terms of the amount of impact they have. So it's a way to compare between lives saved, like years of healthy life gained, disability prevented, incomes increased. It's a way of kind of taking all of these different outcome measures and unifying them into kind of one impact metric. And so that's kind of at the core of what we do, and I think a little bit differently in terms of how we think about cost effectiveness. So we're thinking about not just like, is what we're paying a good amount to be paying for this outcome, but is that worth paying for relative to all these other interventions that we could do,
that we could
pay similar amounts of money for, that would generate different outcomes. And so comparing between those. And so I think that's kind of central to us as an organization. It's what motivated our original pivot from agricultural microfinance, as Umar was talking about, into malnutrition. And then because acute malnutrition treatment is this kind of big, complex realm of like a variety of different overlapping interventions, in all honesty, right? It's a very high touch intervention. And so there's a ton of different micro decisions about like, how do we execute this portion of programming? Do we include this portion of programming? It allows us to feed into our program kind of an overarching question of, is the money that we are paying for this certain thing, which is buying us this certain outcome, worth it? So like, one way that this probably manifests itself in our programming is we put less emphasis on behavioral change portions of malnutrition treatment as intervention and counseling, where oftentimes you'll see, mothers brought into programs and lectured at for a long period of time about like, you need to do this at home differently, you need to do these things differently. We're kind of skeptical of the evidence base of like those things work. And so that requires a lot of staff time. And instead, like we'd rather like make the decision to have staff treat more patients in that time as opposed to doing that counseling, because we don't think the outcome that we're buying with that counseling is kind of like worth the squeeze.
Okay.
So I think that's kind of like the first big overarching culture point that I think we think about differently than some other organizations.
Yeah. And I just want to be cognizant that our audience is not just Americans, right? So I just want to make sure that when we use terms, so Umar, you used the term UC Berkeley, so that is the University of California in Berkeley, in California. So it's a particular campus of a fairly well-known set of universities, if you will, in California. And then before I turn to you, Umar, to tell us a little bit more, without getting too much into the content of the programmatic approach, because this podcast is about the organizations, right, behind NGOs and nonprofits and philanthropies. But about the programmatic approach, Justin, one more thing. Can you just, for our audience, briefly explain not just what GiveWell, which you mentioned, does, but what that category of intermediary online sites does for both to educate donors as well as to educate the actual grantees, nonprofits, etc.
Yeah, so I think that the central idea of GiveWell and kind of associated organizations and some of their top charities and organizations that try to think in the same way is that there's a limited amount of dollars going into philanthropy, right? And it's important to kind of think about how can those dollars be best spent? What is the most amount of impact that we can generate per dollar? And I think that comes kind of with two components. One is kind of a more traditional sense of like, okay, what is the dollar that is going to this charity buying in terms of like, how effective is it or cost effective is it in terms of generating like a specific output and thus a specific outcome? But then it also attempts to compare between outcomes of kind of differing categories. So you might have a charity that promotes children being in school more, and so leads to additional years of education completed. You might have another charity that through some other metric raises a family's incomes. So that's, for instance, what we did when we did agricultural microfinance. It's what like Give Directly, which is direct cash transfers, attempts to do. And then you might have an organization that does something more explicitly health focused, that attempts to save a life. And that's what we do now. It's what organizations like malaria chemoprevention or distribution of insecticidal bed nets do. And kind of traditional philanthropy, I think, looks at these kind of different interventions and says, these are very different things, and different donors kind of based off of their own interests. Maybe you have an education passion. I'm going to give money to the education charity. And then maybe like the very best donor will say, well, let me try to find the best education charity to give my money to. And GiveWell says, and I think we kind of say, that's probably not the right approach. Like all of these are attempts to improve the life of someone. We can attempt to come up with a way of weighing between these different things. How much more valuable is saving a life than raising someone's income, for instance? And if you can raise someone's income by more times than it is worth saving life, then you should do that instead of saving the life for the same amount of money. I think that's the kind of crucial point. Obviously, this requires like a number of subjective judgments, but it is kind of a best faith attempt to do this and thus allocate donor money as effectively as possible.
Yeah, so that is quite it's quite a rigorous and very specific methodology that is not necessarily widely used yet, for instance, here in the United States, but has gained some prominence. Before we go deeper into how this way of thinking, this mindset, which is where I want to go, has influenced your organization, Umar, is there anything on the programmatic side, the child nutrition programmatic side, that what Taimaka has learned and how you do it that you think makes your organization stand out compared to others who work on child malnutrition in any shape or form?
Yeah, I mean, like Justin was, saying in terms of like, culture and what we value, and then, one of it being the cost effectiveness. So the second thing that we highly value, almost at par with cost effectiveness, is evidence based.
Okay.
So we think that we really make sure that, we implement in terms of like SOPs, in terms of like protocols. They have, we must have, strong evidence, behind, everything that we do. Not just reporting some of the numbers, like like Justin was some of the behavioral changes that people advocate that they do very much. So we'll go like a layer deeper in ensuring that there are evidences out there that suggest that these kind of approaches or implementations really work, and they give results in terms of impact.
And Umar, would you say that you, meaning Taimaka, opted to go a layer deeper? I liked that expression because you observed in other practitioners, whether in government or the private sector or nonprofits and charities, you observed a lack of certain things. Would you like to comment on it in general terms, which you observed?
Yeah, I think people tend to hog the more traditional approach, to matters, and even if there are new evidences and like new approaches, to matters, implementation, behind it, of like people adopting this new, new ideas, that are backed, with more evidence. I think it's lacking, in some contexts. I mean, the state government, or the federal government, would like to like review or review its like, protocols like every 4 years, every 5 years, or every 10 years. But with us, we could find like a new research that was published yesterday, and the evidence suggests that this is like very, very good. We'll just adopt, there's something that we could just adopt, the next day, which I think is something that, government take a more bureaucratic, approach to things, more than, us, me and Justin just, hitting our heads together and say, hey, that's good. We should do it. And then, we're just, doing it, the next day. So I think that's sort of element that we really, enjoy.
That you enjoy and also value, right? And we'll go a layer deeper on that as well, how you do that as an organization.
And if you don't mind tossing it, just to kind of toss into visualize what that looks like a little bit. I think that translates into us being able to kind of optimize our treatment program or strip certain things out, because we don't necessarily have a dogmatic focus on the way things have always been done, but a focus on like what the evidence supports. And by that evidence, we typically mean like academic studies and things of that nature. And so, for instance, like the average cost for an NGO in northeastern Nigeria to provide treatment for a severe acute malnutrition patient is kind of north of $200 in like the $240 to $280 range. It costs us $110 per child to treat a severe acute malnutrition patient.
So that's half or more than half. And you actually, I hear, what it costs for you as compared to others. And that's something that I want to come back in a moment, that even being aware of what is the actual cost per unit of outcome, if you will, is an awareness that we've only seen more recently. So we'll revisit that in a moment. But let's just go a little bit also to, actually, no, why don't we go there now? Why don't we do that now? So let's talk about that concept of cost effectiveness, right? As I just said, and as Justin just said, what is it? How many dollars do we need to spend per unit of outcome, right? it's my anecdotal sense that cost effectiveness, and I don't claim definitely to fully understand the concept. I'm not an evaluation expert by any means, but that awareness of how much does it cost us per unit of outcome to quote unquote produce or to contribute, depending on what type of intervention, right? We're not just talking in the NGO community about human services providers, but you're talking about advocacy organizations, you're talking about organizations that want to influence public opinion, et cetera, et cetera. But that awareness of that, we need to know how much it costs and is this the best use of our money, seems to be one of the last frontiers in evaluation. Why do you think that awareness is only of a recent nature, if I could state that? Why do you think that is in our sector? Can I invite you to speculate about that? Maybe Umar, starting with you.
Yeah, I mean, sure, to give it a go, but I think Justin is the more expert here in terms of putting the cost effectiveness data and what have you. But I think in kind of like a layman, understanding of the whole matter, especially in the health space where we use maybe cost per life saved, in trying to see what is the cheapest way or the cheapest approach, to save a life.
Yeah.
So it could be like bed nets, maybe say with $100 or less than that, you could save a life, just by providing, bed nets. If you translate this to like other interventions, it will like, you'll be running into the thousands, just saving like one life. These numbers, might not be really correct, but just trying to give like a, a very clear example, to the listener. So basically that's what we do. So we try to see, how much of work do we need to put, before we save a life, and how much that cost. And so that would basically be the, just be the cost, per life saved. So do we have to, in some interventions, like break the bank before we save a life? Or can we just save a life? Or, with that same amount of money, saving one life, we could save several lives. But like I said, Justin is the one who has been crunching the numbers here, and I think I can see him itching
I bet he is. Justin, before you jump in, and again, yeah, let's make sure that we don't go too deep into the particular intervention that Taimaka focuses on, but more about the principle of cost effectiveness. I mean, is there an ethical side to this? Is there because some people might object to the language that we're using, like it doesn't matter how much it costs to save a life. Every life needs to be saved, and this whole discourse is becoming too utilitarian. So Justin, jump in general, but also can you tackle that question, please?
Yeah, and so this is speculative, but my expectation of the reason that this has been somewhat slow to adopt is only more recent, and I would very much say that I don't think that this is necessarily like where the sector is going. I think cost effectiveness has become a buzzword in some ways that is then kind of utilized wrongly by a number of organizations. So I'm not necessarily saying we're trending in the right direction, though there's certainly been progress. I think it comes down to two things. I think the first is it's just really hard to do well. And so
I imagine.
I think especially if you are kind of a traditional large-scale implementer, you often don't have good cost data. You have to spend a lot of money to get really good cost data. Though I'm somewhat skeptical of that. There seems to be this like cottage industry of cost specialists who sprung up that probably really overcomplicate this, but regardless. But it's really hard to do. And then like even if you get good cost data, then there's like a number of subjective judgments that have to be made on the evidence and the impact side that like reasonable people can disagree about. So it's hard to kind of cohere around one framework. But the I think more interesting part is what you were getting into, is this kind of like, this is a very explicitly utilitarian exercise. And I think there's like this is the charity sector, right? And so most of us, I think, get into this because we are something of a bleeding heart. And to speak frankly, I think that's true.
Yeah. And whether that's always a good thing is another thing. But anyway.
Yeah. And so there is like a strong resistance to making decisions around like, you know, well, but this is helping people. I can see it in their faces that this is working.
Exactly.
And it's hard to think about, well, okay, but I could do more good spending this money elsewhere, but that requires me to very explicitly stop helping these people who I already know and can already see and can already visualize. And then I think there is like a strong resistance to this concept, like particularly in the health space of, well, yes, if we spent, you know, $15,000 on this kind of care for this child, we could save their life, but it, you know, it would probably cost us $3,000 to $5,000 to save the life of a child in this other way, and so we could save more children by changing this amount of money. I think there's a strong resistance to that for good reason, in the sense that like we don't necessarily want to be making medical decisions around you know, pure utilitarian outcomes, right?
Right.
I think the problem with that is that sense of medical ethics is very well calibrated to kind of like a resource, an unrestricted resource environment. And oftentimes what is maybe found in Western hospitals, the important rationing decisions and things have to be made there as well.
Yeah.
But it's just not realistic in low and middle income countries, at least in the conditions where we find ourselves, where like there is never enough care to go around. And by choosing to like spend that $15,000 on that other child, you are denying that care to those other children that you could have saved
It's
for
a
cheaper.
true trade-off, in other words.
And I think that is an uncomfortable position to be in. And most people do not want to have to make that trade-off. And so it is easier to deal with what is right in front of you than a counterfactual that you will not necessarily see.
Yeah.
But I do think it is kind of illustrative to change the wording on this slightly, which instead of thinking about, you know, okay, I can save the life of this child for $15,000 versus saving the life of another child for $3,000. It's useful to think about, okay, if I spend the $15,000 on this child, I'm killing 3 other children because they won't get care. And that sounds really aggressive and abrupt,
That
but I think it's
sounds really
realistic.
harsh, but you're saying
it's practically what ends up happening.
Yeah.
And so, you know, there's obviously, this is a very dangerous line of thinking, right? Because like, you don't want medical professionals making pure utilitarian decisions all the time. And you also, like, the pure utilitarians, I think oftentimes like don't understand that like they don't have all the information. They don't have perfect knowledge. They are not perfect computers. They cannot calculate these things out. But I do think it's important to calibrate in between embracing medical ethics and, you know, making sure every child gets all the care possible, and also recognizing kind of the realities of situations where you need to triage care, which is very much a part of medical ethics, of prioritizing care and prioritizing the resources based off of how you have.
And as you say, also in Global North hospital situations, that definitely also happens to a certain degree, even if we're not always transparent about that. Yeah. All right, Omar, with you, let me move to what I would think is an adjacent topic, and that is just the very fact of evidence-based decision-making in Taimaka, right? So when we did our preparatory conversation, the two of you said we have an evidence-based culture. Now, that sounds beautiful. A lot of NGOs these days would like to say that, but I want to know what that looks like. And so my question to you, Umar, is to what extent does Taimaka truly make sure that the data that is collected on evidence, that offers evidence, is actually analyzed, synthesized, and translated into actionable data for decision-making in Taimaka? You're a small organization. You just indicated, both of you talked about responsiveness, etc. But still, what does that look like, organization, from a decision-making flow perspective? Umar, first to you.
Yeah, sure. I mean, like you rightly said, it is one thing to have access to this data, but it's definitely another thing to, make this, into practical, actions, in the field. And that's why we have like a very robust, a research and innovation department or unit, whereby they go, take some time, go to town looking for all the, studies, and researches that are being conducted, that have been conducted, in that particular field, and then doing like, in-depth, literature review, and then coming up with, all these good evidences, and, good ideas, that have been backed by these, tons, of researches, that have been done there. So we'll have like two approaches, to that. One will be like, okay, we have this evidence and we're very happy with it, and then we're just ready to go now. And then the other one will be like, okay, this could work or could it not work? And then we could have like some mini pilots in just trying to establish or proof of concept, sort of thing, just to make sure that these evidence or these ideas that were tried and somewhat work, in some context will really work, in our context. So if it turned out to be that we have to do like the latter, that means after that, we will have like a more robust, data and information, in how like we will implement this, into our day-to-day activities. If it is the first one, it will be like, okay, this evidence has been there. Maybe it has been implemented by other partners, in the field. And then it will be us now researching, having, talking with the experts, in that field, talking to these partners who have already kind of implemented this and how they have done this, and then trying to streamline this, into kind of like our organizational sense of how we do things. So it could be this has worked, say for Alima or UNICEF, and this is like a very good idea, but then we will come and maybe we could find that the approach to that is not as cost effective maybe as we would have loved it to be. So we will have like some reshaping and some panel beating, to do that, just so that it fits, both our cost effectiveness bar. It meets both the cost effectiveness bar and also the evidence, bar. I can feel that this could be very difficult at times, in trying to practicalize these things, on paper and kind of implement it on the ground. But the research team, with help of the implementers on the ground, have quite, done some reasonable good work, in this field. And one notable example of this will be using Tom Brown, like in the management of, our moderate acute malnutrition, which is something that we've seen, in the literature, somewhat, practiced by Catholic Relief Service. But I think we are able to absorb that information, synthesize it, and kind of, come up with clear protocol, or, clear protocols, on how this can be implemented, on the ground. And it might interest you to know that our recovery, rates, in that aspect is, in the high 90s. I mean, correct me just if I'm wrong, but I'm sure it's like 98% or thereabout.
It was 99 last time I checked, which in fairness was about 3 months ago.
So I want to ask something about, Justin made a reference earlier to the fact that many of us are in this sector, amongst us, because, and these are his words, but I think he's right, bleeding heart kind of people. And again, there's a lot of criticism on that, especially, around the theme of white saviorism, etc., and rightfully so. But in our sector, there are a lot of people who think they know how to make the world better. I'm being simplistic here, but for a purpose. I'm wondering if ever, now your organization is not small anymore. You now have what, about 70 staff? Is that right? 70?
About 100, I think.
100. Now you're really growing fast. That some people throughout the organization are convinced that X or Y is the right approach, right? And they're very married to that idea. So does it ever happen that because you try to be evidence-based and you do rigorous literature review and look at comparative evidence, et cetera, that there is resistance to changing, let's say, the protocol of treatment, because some people in Taimaka truly think that we should stick with, so that you get resistance to change, where people say, well, but that evidence is not really true because so-and-so. Does that ever happen? I could imagine it could. Umar?
Yeah, I will say one problem that we usually face, with staff in terms of how cost effective, we are, will be with their pay, right? Because we want to pay them, fair enough, but not too much that will skew our cost effectiveness. But I think in terms of, bringing this kind of like, ideas that we strongly believe will cut cost. I think I don't know if Justin has a good example there, but I have no clear example that we kind of struggle with staff kind of absorbing some of these new ideas that we think are highly cost effective. I think maybe I would say with Tom Brown, we think is very cost effective, but there might be some reports from the field where there's some kind of food aversion by caregivers. Or by the child, itself in trying to administer this thing, just because people look at it to be less, to be inferior to kind of like the package ready to use therapeutic food. Yeah, I think that would be maybe one thing. And, it's not, it's just not very sweet, compared to plum peanuts. So I think that would be like some sort of that pushback from the field staff.
So that's
who
from
have seen
participants in the
firsthand.
program, you mean? Yeah, I was thinking more about stakeholders inside the organization. Justin,
So I would, yeah. So, but to Umar's point, I think what you'll see is participants in the program will then voice complaints to field staff, and who will then voice those complaints upward or create opposition as a result. And that is a good thing, right? Like, we want that feedback.
Yeah.
But I think what I would say is yes, we do see this. We do see this resistance to change. And I think it can either stem from two places, or I would say three places. One is field staff or intermediate staff or managers know something that we don't. That there was something captured in our data, something that was not captured in our data, that was not captured in our literature review, that was not captured in our modeling. And then we want people to be able to speak up and say, hey, that's actually a bad idea. But the other two versions of that are not as good, and that you can kind of address in any order, are kind of a version of that where, for instance, as Umar was saying, you see a specific group of people voicing complaints. Those complaints kind of come upwards and turn into opposition. But the opposition is rooted in the fact that a staff member or someone is seeing only kind of a very narrow slice of the issue. And so where they're seeing a problem, we look at kind of an aggregate and we say, yes, that is a problem, but it's outweighed by the benefits we're seeing in other areas. And so I think what is important there is you oftentimes, we found with staff, need to show them a larger picture of the problem instead of just saying no, no, we're not worried about that. Thank you for sharing it, but we're not worried about it. Which is A, frustrating for people, and B, kind of discourages them from sharing feedback in the future, which you want. It's important to go back to a staff member and say, okay, but what is the reason we are saying no to this is this. We are looking at this larger slice of the issue. We are seeing kind of these other benefits. And here's why, we agree with you that this is a problem, but we're saying, it's not sufficient to actually change anything. And I think that helps a lot of people where they feel like they can see the kind of bigger picture, and they can see what is happening. And so they become more aligned, they get on board with the issue, they feel like their voice is actually being heard instead of just shut out of the process. And then kind of the final area of resistance that we see sometimes, and this is more problematic, is people who are very stuck in their ways. This is the way we've always done it. This is the way that it should be done. I think, unfortunately, we oftentimes see this from people who've spent their whole careers in kind of the traditional humanitarian sector, because those sectors, for better or for worse, if you're a local Nigerian staff, they train you reasonably well to do some things very well, but there's only one right way to do those things, and it's the organization's way, and change is not really something that happens. And I think we found sometimes when staff come over from other organizations, it's difficult to get out of that mindset. And so I think like it's always important when we're trying to be evidence-based. And this goes back to like not just dealing with kind of disagreements and pushback, but also just to how we make decisions in the first place. It's always really important to think about like, what information could I get that would change my mind on an issue? And so that's useful for like shaping research questions, shaping data analytics. But it's also important that like when we're dealing with kind of staff pushback of asking that question, like what information could you get that would change your mind on this issue?
Yeah.
And unfortunately, I think there are some people we've encountered where no information would change their mind. And that's kind of just antithetical to the culture and antithetical to that evidence-based decision.
Antithetical to the culture. Let me challenge the two of you. And I'm also noting for our audience that Umar may have to shift from one way of being on a Wi-Fi network to another way. So if his camera drops, etc., then that is because of that, or if his audio changes. So we're just keeping it real here. But let me ask you just to follow up for a moment, maybe Umar, if you can, if you're in a position to answer. If not, we'll go straight to Justin. But does it ever happen to the two of you that no information, no data could ever change could change your mind? Modeling, as you know, is really important, right? As leaders, right? Everybody watches your behaviors. Do you feel yourself ever being challenged to model those aspects of the culture that you have just said you're espousing as Taimaka? And how do you deal with yourself in that regard? Umar, is that something you can take on right now? I'm just checking to see what your Wi-Fi is doing.
Yeah, I think my Wi-Fi is still fine, but do you mind coming again with the question?
Yes, I can. So when Justin just ended by saying when we see staff opposition or resistance to accepting new evidence that is about effectiveness or cost effectiveness, etc., that you ask staff the question, basically, what information would make you change your mind? My question to the two of you, as two of the leaders in Taimaka, do you ever feel yourself challenged to be open to new evidence? And given how we know how important it is for leaders to model the behaviors that they want to see everybody espouse, right, and embrace, how do you deal with yourself in that regard? Umar,
yeah, I mean, believe me, it has not been easy trying to, adopt, new ideas that are, evidence-based. I mean, when we pivoted from our post-harvest loans to, to community management of acute malnutrition, I mean, it's tough. I mean, these decisions are like tough. We just have to because it is, embedded, in us, that, this is what, we want to do. The
yes,
pillars,
exactly.
that we want to build. Yeah, exactly. So the pillars that we want to build this organization, are mainly cost effectiveness and, evidence-based. I mean, even to us at times, we'll be like, all right. I mean, in recent times, when I was, with Justin in London, and we were anxiously awaiting what GiveWell, GiveWell are going to say about, our program. We were like, this means when GiveWell says that, community management of acute malnutrition is not as cost effective as we previously thought. Is this something that we have to pivot again? Yeah. So these decisions are not, even to us, for us, they're not that easily absorbed.
No.
But I think it's something that we've vowed that, that we will embrace, come rain, come sunshine. But I know Justin will have much more to say here. So.
Maybe not, Justin, because I'm looking at the time and I see time has just rushed on. So maybe a short complimentary answer, and then I have two more questions for the two of you.
Yeah, I'll be quick. So I would say two things. I would say the first is kind of expect that someone challenging your viewpoint and saying, no, I disagree with that, and here's why, is going to hurt. Like, I personally find that very difficult. It's just like being told you're wrong is not fun, right?
For nobody.
And so for nobody, there's nobody in the world that likes that. Or if there are, they're a very special person that I've not met yet. And I think it's important to just come to expect that. like make room for the feeling. Because I think if you run from it or try to hide it, it's just going to get worse and worse. And kind of remember in the discussion that everyone has the best interests of the organization and the decision at heart. And so it's very useful to like decompress afterwards, hang out with your colleagues on a friendly basis, like reminder to not take it personally, but like don't try to just suppress the emotion and hold it in, because that's no good for anyone. And then the second thing I would share is in these difficulties of modeling these things, I think what's been very useful is that Umar and I are both co-founders of the organization. And so we have peers in each other that if like it was just one of us running Taimaka, we would not have. And so I think that makes it easy to have someone who can hold you accountable to living up to those values and say to you, hey, I think you probably like we're not engaging in this discussion productively, or to say that vice versa to the other person, or compliment someone when they do take it well. And I think having that peer relationship, that joint accountability is useful for dragging someone back on the path.
Dragging somebody back on the path. Yeah, got it. All right. So here are my last two questions, and I'm asking for kind of a quick response. So the first question, maybe to you, Umar, is so Taimaka explicitly works with academics who you're not just taking in through literature review or previous, academic research, etc., on your type of intervention as compared to others, but you're also actively working with academics to do randomized controlled trials, which we don't have time to go now, but are one form of a more rigorous kind of data collection. I'm curious about what do you find the top 2 or 3 challenges, Umar, in collaborating with academics? Because there's a fair amount written about when practitioners try to work with academics, it can rub on both sides, right? So what are the top 2 or 3 challenges in Taimaka's case in working with academics on rigorous research? And how have you found ways around that? So maybe that question to Umar, and then I have one more question for Justin.
Yeah, so I think the first thing will be in the sense that from a more programmatic perspective, where academicians maybe look at it from like, I'm presenting. So I think trying to find balance in the sense that, this data could be used, for both, in the sense that it could be like academic paper, but it could also be something that could be easily, I think, implemented. I think it's a good, I think it's one pain point. And maybe to add a second to this would be, I think in terms of maybe some of the collect our data and, might be different from what maybe academicians would like to see.
Yeah.
In this, yeah, so like our data might be more complex or will not be maybe that stereotyped to the sense. And that might pose like a lot of a headache for people to like access it and process it. Yeah, so I think, a system, especially of both works for all of us, I think will be another thing. I think Justin has worked maybe data theme, so maybe he could add maybe more to that.
Okay. Justin?
Yeah, I think like cleaning your data before sending it to academics is very important. So you've got to budget time to do that because it's a huge hassle. But then I would also say, I think to echo Umar's first point, it's just very important to be upfront with each other of like, here's what we will deliver. Here's what we're both trying to get out of this project. It's setting those expectations clearly from the start, because I think where problems can arise is academics then come back and say, well, we're really interested in this other question. Like we've got this novel elicitation technique or whatever. And it's very useful to be able to refer back and say, hey, that sounds super cool. We're not able to do that. And that's, not kind of the focus of this project. And as long as you guys have been clear with each other to start with, I think that if you run into problems, if you're not clear about that, and then people get upset because you're not doing what they thought you were going to do, and vice versa. And so I think it's important to set that clear.
Yeah. And I'm painfully aware that this was a very, very short treatment of a particular that question on collaboration between academics and practitioners, but we will have to leave it at that. So Umar, last question, maybe to both of you, but starting with you, is so Taimaka has grown very fast, right? That sounds desirable at face value for many nonprofits, let's face it, although there is also a fair amount of pushback now in the sector around, especially when it comes to what I would call global north founded NGOs. In your case, you're more clearly of a hybrid in that regard, but against the whole growth assumption that growth is good, etc. But let me also leave that aside. But when you grow so quickly in terms of budget size, population that you try to serve, etc., it's not just a good thing. It can also cause real, you have to start adapting policies or putting in place policies where everything was kind of working on a kind of a family model of an organization. So you have to have more standardized practices. You have to standardize quality. You have to set up systems and processes. And Taimaka wouldn't be the first NGO where that was actually experienced by many people, especially who joined in the first phase, whether they are founders or just early staff, if you will, and leaders who don't necessarily embrace or enjoy all of that. So Umar, starting with you, how does Taimaka try to navigate this startup to ramp up phase from an organizational perspective?
Yeah, so I think this is exactly where we are at the moment. From, friends and family working in one sitting room to now having close to 100, field staff, and then everyone come in with his kind of idea, with his mindset, with like previous experience from other workplaces. I think it has been quite challenging, especially in terms of like drafting policies. We could just like sit down with Justin when it was only two of us who work for Taimaka and say, hey, how much do you want to earn? And then we just like agree, in like 5 minutes or so. But now we'll have to like, calibrate, a different cadre of staff salary. We'll have to come up with like policies that address staff growth. Because like, in the past, people were not even, that worried about, their growth. And I think as people, yeah, and I think one thing is that as we grow, people tend to see themselves growing with us. So I think that also in this, I think poses, different, challenge in the sense that, okay, we're like a 500K maybe organization this year, next year we go like 1 million. I think in terms of just the organizational, exponential, scale up, people see themselves also scale up, at that level. Which is quite a bit, annoying. But I think some of the mitigating ways, that we have here in terms of like policies, is in the first place like recruiting the right people, right? Get the right staff who you think will have like the right, mindset, giving them adequate training in terms of what we do, and how we see this organization and where we want to take it, from there. And I think lastly and most importantly is also onboarding staff, which I will admit that we haven't done maybe a very good job, in that aspect. But it's something that we really identify, as a problem and as a challenge, and we are really, after it. So you could just have staff who you think, hey, that staff looks good. I mean, his interview went perfect. His test tax during the interview with aptitude tech was superb. That that guy is good and he's good to go. Let's send him to the field, tomorrow. But I think what we realize with that is that there's more to do, in terms of like bringing people on board in like what is Taimaka, and then the values, and the cultures that we hold very dear, to us. So I think still some work in the
Near what the internet.
And that's where the internet went in Umar's place. Okay, Justin, then I'm gonna ask.
But I
there
think the
you
way,
are.
kind of like established. Yeah, so I'm just trying to say, in the way that we expand, but try to expand with like the culture, and value that we have as a small group. I think is definitely a big task and it's something that we are, adamant, in keeping.
Yeah, well, maybe in 2 or 3 years we can check back in with each other and have a much more expansive conversation about it. I feel that this topic too could merit so much more discussion. But Justin, you have the last word on this one.
Yeah, I would just kind of echo, this is very hard, and we have not necessarily always done a very good job of it. I think in some places we have, in some places we haven't. particularly that like scaling culture bit. Like it's very easy when you have 8
Mm-hmm.
people and they all work day to day with myself and Umar, who have the culture and have the values. You can kind of just disseminate culture by osmosis, right? But then when you hire 30 other people and then they work in field sites that you're not visiting every day, you're not working with them day to day, that like culture by osmosis doesn't necessarily work as well.
Yeah.
And so figuring out ways to perpetuate that without that, I think has been a challenge. I think the kind of key lessons for us is basically growth to do well and to do sustainably will take longer than you think it should. And like there's a trade-off between like you can hire 100 new staff tomorrow and you open a bunch of new facilities, but like that is going to create a whole suite of problems for you that you're going to deal
It
with
might
in
actually,
6 months or 12
yeah.
months or however long after that.
It might actually harm your organization in irreparable ways, right?
Yeah.
And that to be really that to use that overused word intentional about it is super important. I really feel called to circle back to the two of you in a couple of years and to say, let's have Justin a conversation on that and maybe also involve Olivia in that one. So we have to bring it to a close. So Umar, starting with you, if people want to find out more about Taimaka and about you, where should they go? If you can hear us right now. If not, I'm going to turn to Justin first. Ah, there you are. Go ahead, Umar.
Yeah, sorry.
Did you hear my question? Or
yeah, sure.
You did? Okay, go ahead.
No, I didn't. No, I didn't get the question, unfortunately.
Not exactly your fault. My question was, since we need to bring the interview to a close, where can people find out more about Taimaka and about you if they're curious?
So I think our social media presence isn't that bad. So I think taimaka.org, people can find quite a lot of information there in terms of how to contact us. The external at taimaka.org is one email address that you can always reach to us. Yeah, I think I have some panel bitted LinkedIn presence by Olivia and Justin, thanks to them. So I think people who also want to see more about I think what myself, and I think and also we have is a LinkedIn also presence for the Taimaka Project. So I think people can also follow that up and see, and like this has been updated quite sporadically, but Olivia tries to update it when like there's something exciting exciting happening with us.
Okay.
Yeah, so I think these are some of the places I think that we can easily
we can
get you in
include
touch.
those. Yeah, we can include those in the show notes for sure. Justin, anything to add to that on your end or the organization?
Yeah, we've got an email newsletter that you can sign up to on our website. And I think that's a place like if you are curious about like in depth how we make decisions and how we think about things, we try to go into that a little bit more there versus like some of our social media. And I mean, that can get very nerdy. We oftentimes will link like spreadsheets of like, here's how we model things out and why we're doing this specific thing. And then also, Umar mentioned we have that external@taimaka.org general contact email that'll reach both of us.
Yeah.
But then if you want to get in touch with me specifically, my email is just my first name @taimaka.org. So I'm also happy to answer questions.
Okay. Very, very good. Yes. And I'm just thinking, oh God, we could have also talked about, as you know, there's a whole discourse in the sector at the moment, meaning the NGO sector, around decolonizing aid and decolonizing NGOs and the nature of knowledge and whose knowledge and expertise counts, local knowledge versus global north kind of imprinted knowledge, experts, what is expert and what is lived experience and all of these things. And we don't have time for that either. So another chapter will be coming up. I feel it coming. So I want to thank both of you, Umar and Justin, for this wide-ranging episode. And thank you, listeners, also for spending time with us. If you found this podcast episode stimulating, There are a couple of other episodes in my podcast, NGO Soul and Strategy, that focus also on nonprofit performance, on what I call having an outcome orientation, evaluation issues. So episodes 7, 9, 46, and 74 came to mind. And you can find those episodes on my website, 5oaksconsulting.org with a number 5, and also on my YouTube channel. Subscribe to my email list, just like you should subscribe to Taimaka's email list if you're interested. And you will always be the first to be in the know about the next exciting episode coming up. With that, I'm saying goodbye. See you next time at NGO Soul and Strategy.